Well, it came about largely because at our last state conference, in the discussions that occurred between me and the rest of the organisations that were there, they were expressing a concern that they didn't have the skills to look into the future and to plan for the future. So there was a lot of concern in those services about that. And so what I suggested, given that Keith and I had worked about 13 or 14 years ago now on a scenario planning exercise for residential aged care when we were both working with Uniting Care, I thought that was the best tool to use because our current environment is extremely uncertain, particularly in terms of the continued funding of Meals on Wheels services, given the gradual introduction of client-directed care. And therefore the whole environment for those services is really quite insecure and uncertain. And it seemed to me that scenario planning was the best tool that you could use in that kind of environment. Well, the thing you need to remember about scenario planning, it's really important for people who use the tool to understand that it's not about predicting the future. It's much more about anticipating it. So it's recognising that nobody can really successfully predict the future over the longer term. I mean, some people might be successful on the odd occasion, but by and large, you rarely get it right. So the important thing is about looking at what are the alternative plausible scenarios, identifying them, finding the things that will tell you whether those scenarios are emerging, so that you can start to develop plans to deal with any one of them should they emerge. So it seems to me that's the key in these circumstances.
Yes, I've been involved with scenario planning for about 30 years, and one of the projects in which I've been involved, which is in the public domain, is the report that Les referred to, which is on the future of aged care. That was published 15 years ago, and it's interesting that one of the scenarios we did foreshadow, namely that people living longer, wanting to stay longer at home, the service being brought into the home rather than going into the bricks and mortars of Uniting Care or other retirement villages, we were spot on in terms of that scenario. So that's one example. I'd say a more recent one is that I've just been awarded my third PhD, which is on the future of the Uniting Church. And the Uniting Church, on the one hand, it's got declining numbers of members, but at the same time, it runs a lot of aged care, child care, university colleges. So it's very interesting. On the one hand, you've got a declining number of congregations, and yet at the same time, if you bring together all of the Uniting Church aged care, welfare facilities, hospitals, etc., into one corporation, quoted it on the Australian Stock Exchange, would be larger than 90% of the entities listed on the stock exchange. So religion is big business in that respect. So the doctorate has been done to help members of the Uniting Church and other religions just think through the implications of the new era into which we're moving. Scenario planning was developed in the 1960s by the Shell Corporation, and they were correct in identifying the risks with a dramatic increase in the price of oil. The person who was involved in that went on to retire and spent some time in South Africa, where Clem Suttner, who's part of also of our global business network, Clem Suttner was working for the biggest corporation in South Africa, which in the 1970s and early 80s was violating the laws of apartheid. And his company said, why don't you develop scenarios on the future of South Africa? And with scenarios, you produce either 2 or 4, never 3, because the client will go for the middle one. And the purpose of scenario thinking is to get people out of their comfort zone. So he came up with 2 scenarios on the future of South Africa. One was the release of Nelson Mandela, who was then the world's longest serving political prisoner, the creation of a multiracial electorate, and the election of Nelson Mandela as the first black president. His white audiences were outraged. That'll never happen. The man will die in jail. He said, well, that's the high road. The low road is that we whites are outnumbered by the blacks. They work in our homes. We could be murdered in our beds at night. Tell us more about the high road. And that got the whites out of their comfort zone and started to think about the unthinkable. And in 2001, I was a guest of Annette Lu, who was then the Vice President of Taiwan, and she'd brought together a group of Nobel Peace Prize winners. And somebody asked de Klerk, how were you able to release Nelson Mandela? And he said, well, there'd been this fellow going around, Clem Sutner, giving talks to warn South Africans about the problems we would have if we try to continue the apartheid system. So for me, that's the value of scenario planning, getting people to anticipate the future, to be thinking about alternatives, and get them out of their mental prisons and to explore wider horizons. There are basically three ways of thinking about the future. One is prediction. So it's diagrams, numbers, etc. So we all do predictions. We predict what we're going to have lunch for day, but we may not be successful in predicting the outcome of the Melbourne Cup. So predictions are important, but not necessarily effective. The second way is preferred futures. So with the preferred future, you're thinking of what you would like to achieve, and then you work towards that vision. You build a bridge back from the future to the present, and you work out how you're going to get there. The third way of thinking about the future is possible futures, which is scenario thinking. So what we're doing here is not making predictions. We're not saying this is what we would prefer to see happen, but this is what could happen. Therefore, look for the warning signs, have the indicators in place, and be ready with your contingency plans, ready to step into action. When you're doing scenario planning, it's important to look for the major drivers of change. And for that, you interview the experts, which obviously in our field here is community care in the home. And the task is to produce two major drivers. Overall, in human affairs, there are 5. So you've got social, you've got technological, economic, environmental, and political. So everything is a variation of one of those. So what we did was to look for the 2 major drivers. So one was the level of government expenditure, which would be a reflection of the general state of the Australian economy. And secondly would be what we're calling social cohesion. Some would call it social capital. In other words, the willingness of people to take part in community activities, obviously to serve in voluntary organisations like Meals on Wheels, perhaps the broader safety of the community. People may be willing to serve, but if it's a dangerous environment, they may not feel safe travelling long distances. So they're the 2 major drivers, the level of government expenditure and then the question of social cohesion, social capital. And then having produced those 2 major drivers, you then ask yourself, what would a situation look like of, say, high government expenditure but low social cohesion? And so that's how you produce the 4 scenarios.